Ema. All
Greetings and
right.
salutations.
Hello. How is everybody?
Hello.
Can you
Alive.
hear us? Are you feeling better?
I mean, yeah, actually, yeah, but I still, it's like weird. I feel very like faint, like weak, really gross.
Uh,
I was feeling great last week when we canceled. No, yesterday was bad.
all right. So we're here to do our, I have emailed. So I just emailed both of you maybe 5 or 10 minutes ago, an Excel spreadsheet.
Yeah, I'm looking at it now.
Okay. Um, I have it in hard copy here, and that's what we're going to be talking about. So what I have done, it's okay if I just explain
Absolutely.
the spreadsheet. So I've input each scorer's score into the spreadsheet and then produced an average. These are currently ordered in the spreadsheet based from highest score to lowest score based on the average score. And the blue line is the projects that signifies where we would run out of funding based on this current ranking. The projects that are in red are scores where there's a 10-point or greater difference between the two scores. The projects in orange are 5 to 9 points apart. And then the ones that aren't highlighted in any color are 4 or fewer.
Can I point out one thing I just
Sure.
noticed? There's a cross point one at the top that's white, and then there's a cross point one at the bottom, blue or red. I don't remember if I was one or two.
Okay. We can, when we get to those, we can pull up the applications. So I think our goal today is to go project by project. It would probably be helpful if one of the scorers could jump in and just give a few sentences about the project. And then my understanding of our goal will be to come up with a consensus score after discussion that will be the final score of for the grant application. My goal in highlighting them in different colors was to maybe identify the places where more or less discussion was warranted, particularly when there's huge discrepancies between the scores. That seems to me like a place where we should clarify
And I
why
say,
there's such. Sorry,
sorry,
go
I didn't
ahead.
mean it. No, I didn't mean to interrupt you. I just as like a, I just wanted to bring something up before we dive into all that. I just really don't think public health, because we don't have enough to fund all of these things, should be asking for more money when they already received like $440,000 or 500. What was it? Something like that. I don't think they should even be on this list,
Okay. They received 550 for the case manager
which is
program.
like 10x plus anything anybody else could even ask for. So it's just not fair.
So
I agree.
I'm sorry. Um, I think that should have been a parameter that we put on the application if that was a limitation.
But it has been brought up several times in passing in this committee. We just never really made a firm decision around it. I don't know. I just feel like that's the deal. When we've got such funding shortages and everybody needs money, it doesn't make sense to give public health. That would be what then 600,000 when anybody else could only get 50. That's just not fair.
I think we're also not the final decision maker. We're making recommendations, and so there will likely be more comment. I'm assuming this is
Yeah.
going back to the full council, right?
Yes, that's
So
right.
it's outside of our scope at this point to decide if it's worthy. They applied, they were scored, they're on the list.
Isn't that the whole point of us meeting is to talk about these things? Like I will just speak from my own inexperience. What I found with the scoring system, there's something that was seriously lacking. Like, does it make sense? Of a 1 to 5, does it make sense to spend money on this thing?
Mhm.
Because there's, I don't know, out of the 13 I had, if I were to wave a magic wand and this was Scott's world and King Scott could just make decisions, there was 3 out of hand that I definitely wouldn't fund. There was 4 that I would, and there was a bunch that I had a lot of questions for. Because like some of them didn't make sense. Like and some of them are in here too. Like well, I don't want, well, we're gonna go through all of them, so I guess we'll talk about it
Yeah.
as we go through. But
So does it maybe make sense to go through first? And then once we reach consensus scores, deal with one-off issues, like are there projects that the committee wants to take off the list despite the score?
Yeah.
Okay.
Right, and I ask a question too, I don't recall seeing the people could, if they wanted less money, could they accept less money? Because I know the county had that on theirs.
that was one of the questions. Yeah.
Yep, okay. So we didn't put down on this what, who would take less money, right?
Correct.
Oh, okay, okay.
So should we just start working our way through the list?
Sure.
So the first one on the list is adoptive and foster families of Maine. I don't know if Scott or Shelley wants to give us a couple sentences on that project for the benefit of the other committee members.
I think it sounded really great. My only concern with it was like the feasibility of that small amount of money per kid to actually do much of anything. And that's just from my own lack of understanding, because I think it was I remember now because I don't have it in front of me. I could pull it up, but it seemed like a pretty small number to accomplish what the things they were saying they were going to do per kid.
Yeah, and it was like respite care for the people that take care of the kids, but also some things for the kids. The one thing that kind of bothered me was I didn't couldn't really tell if it was just Bangor because they said 50% of it would be Bangor and 50% of it would encompass Penobscot County, but that they didn't actually I don't think they actually put one to Penobscot County to get money. So if I don't know about that one. I think if we did accept that, we'd have to put a stipulation that it's just for Bangor kids because they should have presented it to the county. I'm trying to see if they had or not. Does anybody remember if they did?
Don't remember off the top of my head. Does anybody in the room have an
Yeah.
understanding of how that works that if or not it would be feasible?
No, because none of us were able to see
Yeah,
it.
that's right. That's also a
Oh,
frustration
okay.
of how this worked because we
Yeah.
didn't all see everything, right?
Right.
I think what's
Let me,
confusing to me, this is for Shelley and Scott Knowles, is that you both are expressing confusion and a little bit of hesitancy about the feasibility, and it's the highest scored application on the list.
right, which is kind of what I was saying about
Well,
the
yeah, I don't
shortfall of these of the rubric, right? Because if you go by the rubric, it hit all the exemplary marks or most of them,
did.
but there was still like a big question mark around does this actually work? And I don't know because I don't know enough about that type of thing. There's actually the I forget her name, forgive me, but the woman who's usually here for public health usually like talks about that. So I was kind of hoping she would be here because I figured she would know, but I just don't know enough about it. Let me pull up the actual thing so I can give you more information.
Yeah, I didn't score it fives all the way because of that priority population and geographic area thing. I didn't feel that that was covering just Bangor, which is kind of what our money is supposed to do.
Okay, so the questions and concerns I put in the box, and just to be clear, I was not super critical when I was scoring. I don't think anything got under a 40 when I was scoring things. Mm,
Yeah, they did not submit an application to Penobscot County for their Penobscot
Yeah,
County part of it. So
yeah,
that's what
that was one of
that
the
was
other
my
things I
biggest
said.
thing. Yeah,
Sorry, I didn't mean to speak over you, Shelley, but
that's okay. That's all right.
that's also what I said. Is this the best avenue for acquiring this funding because they're asking about a county but didn't apply for the county? But it's right here. It says, "What is the actual impact of only $500 per child at the high cost of daycare?" I guess
Mm. So one option might be, did you say, I'm sorry, Scott, did you say that they said 50% would be in Bangor and 50
Yeah,
would in
in
Penobscot?
Penobscot County, but they did not request any money from Penobscot County.
I don't
So I
see
don't
that as
know,
being hugely problematic just in general, but it does kind of make me wonder why they didn't ask the county for the money instead of us.
or at least half us, half them, if that's what they're spreading it out to pay for.
They may have asked the county, because all I could see is who got money.
Yeah, no,
I
it
can't,
says here, well, on the question they were asked, did you, uh, has an application been made to Penobscot County to fund this project? And they said no, did not realize the county was accepting applications. That's what was written on this application.
uh,
So one option would be to leave the score as is and just say that half the money is going to non-Bangor. We could also consider funding at half the apps.
Right.
I'd be comfortable with half the ask.
Yeah, me too. I
Okay,
would too.
But I don't know. Despite everything that we just said, the application really did seem like a good thing.
Yeah, they did
Again,
have a
this
good
just comes to
application.
like my lacking of understanding. Like, does this already exist somewhere else? How much of this already exists? Like, is this something that we're just duplicating services on, like they want more of? It seems like, but according to the application, it doesn't really exist, but I don't know that because I don't have the experience for it. I don't know if that makes any sense what I'm saying. Either way, I think it scored high because it was a good application, and I don't think it's a bad thing. There was just a couple
Yeah.
questions.
So I have a question though. Do you guys even know what they're asking for? If you never saw what Scott and I saw?
yeah,
Okay.
it says 12.5 here,
No,
25.
but I
excuse
mean
me.
like what it's for, like, because it says
No.
here, okay, can I read something really quick? It says
Right.
this proposal directly addresses the intergenerational harms of OUD and SUD crisis by focusing on placement, stabilization, and primary prevention. When children are removed due to parental substance use, they are placed with kinship caregivers who face immediate and overwhelming financial and emotional strain. The primary harm mitigated is caregiver burnout, which is a leading predictor of placement disruption. By providing funds for structured activities, KSRI offers caregivers essential respite time, which reduces stress and engages youth in protective resilience building environments, reducing their own risk factors for future SUD. This multi-layered approach protects the most vulnerable element, which is the child's stable home, which is necessary for long-term recovery and well-being. They say that the program leverages the best practice of respite care and positive youth development, and it does currently local resources heavily support formal foster care placements. KSRI explicitly fills the gap for informal kinship families. So I guess what there is a program in place for kids that are in the foster care uh,
Right.
system, but there's nothing for just people that maybe family members
For
like
family
I
members.
know.
Yeah, that's right.
I
Sorry, now that you say
I
it,
had
you're right. Yeah.
yeah, I had to start raising two children, and financially we didn't have any help. Um,
I
our
also
brains,
indirectly know that to be
yeah,
true. It's not my
our
personal
brains were
experience, but
fried.
I've seen it. Yeah.
Yeah. So anyway, that's what they're asking the money for. But like I said, I hesitate to give them the full amount because it's not just Bangor, it's also Penobscot County. And they had money to ask for that. You know what I mean?
So are we all comfortable with splitting it?
So I'm gonna share, I just heard about what this program is about. The organization that I work for actually does have a state contract for respite for foster care. So I have a little bit of a conflict and I
Okay.
have zero knowledge about how that program runs, so I can't even be useful.
Okay.
To glean any kind of like truth to what's being said, because I.
Is yours
Uh,
through the foster care system respite or something different kind of respite?
It's a state contract, so it's DHS.
I see. Okay. Yeah. Okay. Thank you.
I think that's also what, again, when I wrote that one sentence of, is this the best avenue for funding? It would seem to me like DHHS would be the one to fund something like that, which is again where it brought me back to, does this already exist and how? But like she just explained, it's for the families who wouldn't qualify for it because they're family instead of just a foster or respite, whatever, where they would be because they're not family.
And separate from that, I've been a foster parent that was a kinship placement and it was handled through DHHS. And I know that
Okay.
that's not always, but that can be the case. It really depends on the situation.
Okay.
All right.
So I believe we need to arrive at a consensus score, which could be 48, 49, the average between the two, or something else. And then we should probably take a formal vote on if the committee wants to move forward with funding half of the ask for Bangor only recipients.
I recommend we leave it, this is just my thoughts, I recommend we leave it at the average.
Okay.
And I move that we cut it in half to make it 12-5. Because they did score high, so.
Yeah, I mean,
I would
it
agree.
was a
leaving
good
the-
application.
I would agree, leaving the score where it is and having Scott and Shelley make a determination whether or not we should split that in half. I did not read this application, so I don't understand it. Scott and Shelley did. I feel that they should make their recommendation on the.
Good idea.
I think half, Scott, do you?
Yeah, that works for me.
Just to cover the Bangor area, because we shouldn't be paying for all of the county.
All right. The next one on my list is Wellspring, with a score of 48 and 43 for an average of 45.5. Does one of the scorers want to give us a couple sentences on the project itself?
Sorry, was that for Wellspring?
Wellspring, yeah.
Basically, they're just looking for bridging funding to continue their actually it's all outpatient services, I think is what it is. But I think the impressive part of that application was they had a good resolution to like for sustainability. If I'm not mistaken, let me pull it up so I know what I'm talking about here.
What did
Yeah, because
Wellspring want?
basically they're looking for a funding bridge to maintain their outpatient programming while they seek to move to a main care OHH billing model.
Okay.
And I'm just thinking like in Bangor specifically, we're talking about Wellspring outpatient. That's a huge proponent of our treatment.
Who's our?
Bangor's, yeah.
Okay.
One of the things I had noted was, where did it go? My mouse keeps dying on me. I'm very sorry. So it's like trying to pull things up, but it's like connected, disconnected. Who was the other person that scored it?
Counselor Hawes. Was me.
Okay.
I know that the county, made sure that anybody that got any state funds, they kept it the people, because the state funds were quite sizable. I don't know if Wellspring's got any state funds, but I would have thought so.
We didn't ask that. did we?
No.
I don't think we asked
No,
that question.
I just thought it was a good idea. I think we should have.
They did not receive county money.
But the Wellsprings didn't, right, I can see they didn't. But that's, I think that has to do with the fact that the county wasn't considering ones that.
Can I make a suggestion real quick, just in the way that we're doing this? Can we just review these without making definitive decisions on each one so that we can go through all of them and then circle back to make decisions? That way we're not like approving some before we get through all of them. Does that make sense?
Well, I think really the goal should be to arrive at a score.
And
Okay.
Because then we'll need to reorder these all
Yeah.
once the scores are finalized. And I think that will be particularly meaningful with the scores that are in red, because the conversation could meaningfully shift them up or down.
Yeah, that makes sense to me. So let's just like keep it to that then, like figuring out the score and then we can circle back if we need to.
And so for this one, score 1 was relatively high at 48, and score 2 was 43. So certainly one option is to go with the average, but if any of the scorers have strong feelings about why they arrived at that particular score, it's probably worth discussing.
Yeah, what was the lower scores for you? What was the things? Because like there's only two categories for me that I scored less than 5 on. So if you've got some insight on the lower scores, I think that would make sense.
I brought my sheets. See? I knew better. So,
And again, I will say, like I said, I was not critical with any of the scoring. Just in general, I wasn't being super critical. I was just kind of reading through the list. Did they or did they not meet the standard of what was being asked specifically from the rubric?
Same here. How can you not say these people don't deserve, you know? But that's why I went on the basics of the actual application and the subjects that we had to grade them on, score them on.
I will say, if anybody who is asking for money because they're like, need the money, I think Wellsprings, from the ones I looked at, Wellspring had an actual solution to the problem that seemed feasible, as opposed to some people kind of giving vague, we're going to work with other partners and get other grants and et cetera, et cetera. As this was like a very specific, intentional plan to like make this work in the future, which I really thought was good.
Counselor Hans, your scores did not, I think it was just the difference in people's scoring methodology. There wasn't a particular area where you scored this one low. It was sort of spread across all of the categories. So it's probably chalked up to purely judgment.
yeah, on any of these, I went that way. I mean,
Suppose that is another kind of shortfall of the way that we did this too, because if you got somebody like me who was not super critical, with somebody else who wasn't super critical, but then with somebody who was, more critical, kind of unbalances everything. But whatever. In essence, actually, now that I'm saying that out loud, I think maybe we just need to keep the averages except for the extremes and just discuss those, because otherwise we're not. Do you get what I'm
Yeah.
saying?
Yep.
Mhm.
So if we go for the average on that one, the next one is Bangor Area Homeless Shelter. They're only asking for 10,000. We have a score of 50 and a score of 40.5 for an average of 45.25.
Yeah, I scored one of those.
That's a me and you, Scott, again.
Yeah. So this was I think this was probably, well, the second lowest score because we had one application that was really poor. It wasn't even really an application. It was just kind of a comment. Let's see what I said here.
So I can give you a brief description of what the Bangor area homeless shelter was looking for. Um, they have people that they place in housing. Um, but they want two things they wanted to do. One, they want to be a hub of the distribution of naloxone, which I guess I thought they already were, but if we could help enhance that, I didn't have any problem with helping that out. Their application to me was very well written. There weren't like I didn't have to jump here and jump there and jump all over. Um, so there's the Narcan distribution, and also they were looking to also emergency shelter, but connecting guests with safe and permanent housing. And they their plan was going to run. Wait a minute, they had a timeline of July 1 to June 2026 on both.
I can just go through my lower scores. The first one was adherence to application. I said they failed to provide a detailed project-specific budget breakdown within the narrative, instead providing only an organization-wide budget worksheet. The response to the sustainability and budget narrative sections and are brief and lack depth. The sustainability was a 3. Cites future sustainability relied on general operating budget, a statement or status quo that relies on future funding assumptions without identifying any new sources. And if they don't need those new sources to fund it, then why are they asking for money to fund it? And the other one was the budget, because there was zero breakdown. They're just like, we want $10,000 for, maybe we'll expand our Narcan distribution, which we already have a ton of in our area.
And then the placing people in housing, helping with that.
But again, that's,
They
homelessness
already
is
do
not the
that
same
too.
thing as
Yeah.
substance use disorder. I understand they're closely related, but it's kind of a different thing in some ways.
So I think what I hear you saying, Scott, is that based on your review, you feel pretty strongly that some point deduction was appropriate.
Yeah, it just didn't make sense because, like, if they needed the money for something, like, I don't know. It's I don't know why we would need more Narcan distribution in our area anyway. But they're already distributing Narcan, so they want $10,000 to distribute more Narcan. But then when they asked us about sustainability, they said they just take it out of their general budget. But they can already
Yeah.
just take it out of their general budget. Why are they asking us for the money?
Hmm.
Yeah.
That's true. I did see that.
And you said that there was a specific timeline attached to when they would use the money?
Yeah, well, that's what's confusing here. It says project timelines run. Oh, they're just telling us their fiscal year. I'm sorry. So their fiscal year runs July 1 to June 30 of 25, 26, and 26, 27. Um, and I think
guess
they're speaking about SUD and alcoholism. I know that this is opioid related money and not alcohol
But
related
I
money.
also find it kind of ironic on some level because they're not a wet shelter. So they don't let people who are actively using stay there, which is kind of the entire population that we're supposed to be serving. Now, to be fair, they did make the argument and they're not wrong, that they do provide a safer place for people who are trying to avoid that. I guess on some level that is true, to be fair.
Did Penobscot give them any money? Because it looks like they applied there as well
They were funded through Penobscot County, I believe.
for the total amount of 10,000 they were asking.
I'm not sure.
Do you know that, Carolyn? Was it 10 from us and 10 from them, or?
Yeah, they got 10 from Penobscot.
It's like the thing is, the application was like there's like lots of great detail, lots of information,
Yeah,
but like what it was not really tied into what they were actually asking for. It was just kind of like a generic, here's Bangor area homeless shelters information with like I think it had support letters and everything. It just didn't make sense to me.
So for this one, we have a score of 50, a score of 40.5 with for an average of 45.25. It sounds to me like the will of the committee is perhaps to go with the lower score or something nearer to the lower score.
Yeah, yeah, I agree.
Okay. So I'm gonna circle the low score for this one. Unless someone,
What did we
Yells.
do, what did we do with Well Springs? Did we just leave it as the average?
we did.
I'm gonna print a piece. Oops.
All right, moving on to Boys and Girls Club of Bangor. We have a score of 50 and a score of 40 for an average of 45. This was Scott and Shelley.
Oh my God, Scott.
This
Mhm.
Scott,
Oh, the other Scott. Okay.
you want me to go first?
Do you want to do a couple
Yeah, go ahead.
sentences on what the project was?
Yeah, sure.
Yeah.
The project. It was long, it went on and on with the project. But it says it seeks support from the city of Bangor opioid settlement funds advisory to implement a comprehensive primary prevention initiative targeted at reducing early risk factors for youth substance use while strengthening projectivity conditions that help young people thrive. Our approach revolves around the creation of emotionally safe and relationship-rich environments wherein youth will find themselves supported by caring adults, engaging in skill-building experiences, connecting with their families. And it goes on for 2 more pages, so I'm not going to read it all. I can tell you, I'll just tell you briefly where I came up with my score of 40. The rational data, the data is not dated and it was only from one source, so I made that a 3 because that seemed to fit. You know, I scored these like the rubric said too. So the project timeline, the timeline was vague and could use some refinement, so I gave that a 3 also. Scope of work, I gave a 5. The SMARTY goals listed, the collection methodology is unclear. And it will be blended in with the rest of their mission. So I didn't really understand what that was about either. And the sustainability, it appears sustainable, but the grant covers startup, but after that, it's relying on other grants. So that's why some of the ones that I scored lower down. You know, I gave them a 5 on the well done. It was well done there. Meets all the priority populations. 5, I gave them a 5 on that. On the scope of work, I gave them a 5 on that, but there was some other things that dragged it down for me to give them a 40. So that's why I gave them a 40. Shelley, you gave them a 50, I think.
You're muted, Shelley, I'm sorry.
Sorry about that. I kind of felt like I feel like they were very clear with what they were requesting and how it was going to support the neighborhood or the Bangor area, I guess I should say. Um, they had some national drug survey results, some different areas of Bangor that are worse than others, as far as needing this type of program. And I felt as though that was kind of true, depending upon where the the overdoses were happening. Um, what did you say about the Smarty objectives, Scott?
The SMARTY goals, the collection
Yeah,
methodology is clear, I thought.
it's unclear
Yeah,
or was clear.
unclear.
Got it. Okay. I don't know. I felt like that was kind of clear, but
Yeah,
you know, when you read so many of these in a row,
yes.
some things are not clear and some are. Yeah, I guess I ranked it high, um because I felt the money would do some good in this area of where what they're proposing to do. And
Oh,
yeah, I didn't find anything wrong on the actual application either. There was some that had some serious
of
issues
course, I
and
don't
this
want
one didn't.
any score either, you know, because I don't.
Yeah, I know. Yeah.
But
Well, we could
So
use, I
maybe,
mean,
sorry,
go ahead. What were you gonna
I
say?
game with splitting it, I guess, you know.
yeah, it
Yeah.
sounds to me like this is one of those where it's just sort of the judgment of the scores.
Yep.
So the average might be a good reflection.
Yep.
Stupid thing.
The colors were really good for visuals,
Yes.
but it's not, my pen won't write over the color,
Well, you're
so
right.
it's creating a problem.
I had to put it over to the side.
All right, the next one on the list is the second Needlepoint Sanctuary project. This was scored by Allison and Shelley. A score of 39 and 50 for an average of 44.5.
Do you want me to talk, Shelley?
Yes, go ahead.
Test my memory. This was for a part-time, I don't work in recovery, so I don't know the right words to use for things. Essentially a recovery coach type position. That was being rated with Penobscot County funding, potentially to provide the other half of that funding. And then also, there was money in this for an outreach vehicle to facilitate the person working in that position being able to take people to their appointments. And it, when I read the description, it was sounding to me very similar to the model that we had awarded for Bangor Public Health, specifically for the HIV cluster, where it was a way to not have to wait for all of the insurance and the other reimbursement to kick in. The person could immediately get referred. How am I doing my sync of words? Okay, so it
Yeah.
put people directly with the treatment that they were asking for, essentially immediately.
And I just not to butt in, but the county did give them 43,000.
Which, and they were very clear about that providing the remainder of that part-time position that this would fund. And that was the way I read their understanding of how this person would interact with Bangor specifically, and then with the county as a whole.
Yeah, it definitely sounds like a duplication of services. We spent a lot of money to set up two case managers and with transportation to already do that.
So to be clear, we awarded the city to work with the HIV cluster population, and this is specific to recovery services. So I'm not easily seeing how it's a duplication.
Fair enough. This is
Only
my misunderstanding.
Did you mean it was a duplication of the county funding?
No, I
Scott?
meant what I said. I was just making a misinformed whatever. Because I didn't realize that. I thought specifically that's what you were talking about, but if it's recovery stuff, that's a whole different thing.
Yeah, it's a similar model, Scott. It's just a different population.
Fair enough.
I have a question though. The one we gave already to do the same thing these people are asking for, wasn't that also for recovery as well as the HIV together? Was it like a combo? Because the people using the needles were the ones in addiction.
That was specifically to support individuals in the HIV cluster with accessing each of these specific services, because there wasn't the contract is not active in the state right now. And this is specifically talking about essentially walk-ins to their facility, or people who are engaging with them at could immediately start receiving the services.
Yeah, and I think the reason what I took from it was that they can, like you said, help the people that walk in and they're not having to actively search for the people because the bus route goes by their new building that they have. If I'm not, if I'm correct, I think that's why Bangor let them have that facility because of the bus route. So there's people going to them that need help that they don't already have a recovery coach for, right? And
That's how
so,
I read it.
yeah, okay, okay, yeah. That's why can I ask
And
a
so the
question though?
30,000,
Go ahead.
as I said, so Allison, you were saying that the 34,000 that they requested plus what they asked for from the county was what they needed to fund that position. There's not duplication of costs there, right?
No, it was 12,000 for the vehicle. And then the remainder of the Bangor award was for the part-time recovery coach. I feel like that's the wrong word that I'm using. And then the county was.
No, that's
providing
that's probably right. That's probably a recovery coach.
I don't have my applications with me. And then the county was providing the other half of that, the salary and fringe for it.
I guess I'm okay with them getting money for, if we have to split hairs, I think I'm okay with them getting money for the recovery coach. Um, but I wasn't sure about the vehicle because I felt like if the bus line goes there and it also goes into town for people's appointments, that's what people use the bus for, right? Or these off-site appointments like out of Bangor.
I don't think that the bus goes by the Ohio Street location. Folks need to walk from the bus stop to Ohio Street some distance. I am not confident how far that walk is. But I
Okay.
Yeah,
don't believe it.
did it say specifically what the transportation was for? Like, are we talking about rides to the methadone clinic in the morning, or are we talking about?
I believe it primarily had to do with like basic needs in the moment and then dosing. But I don't remember. I remember reading it thinking that it made sense and fit with what they were describing, but I don't remember the specifics.
It sounds a lot like the kind of work that I understand that they do too, so that does make sense too.
So it sounds like both scorers think this is a good project, and maybe the difference in scores was just style. That's a good way to put it. Style.
I would almost even say experience too, right? Because like I feel like having just done this for the first time, I was like very clued into just the real specific language in the rubric without consideration to needing a division in points in order to separate things a little bit more. That makes
Same,
sense, but whatever. Yeah, whatever. That was a
same.
completely unnecessary statement, but yeah.
So is this a situation where the average score between the two makes sense?
Yeah, I think so.
It looks like my primary markdown had to do with having to infer impact because the data was limited. And then I had some markdown because I definitely had to work to find sections and answers. It wasn't laid out specifically the same. It was a lot of attachments to sort through.
To be fair, Needlepoint Sanctuary is not like a super well established, super well funded agency that can hire, a grant writer, to my understanding. So just I think it's important that we remember that not all agencies are created equal in their capacity to create these applications. That's all I'm saying.
And we didn't score on internal capacity and organizational stats.
Yeah, no, but it's something like I had mentioned a few meetings back because like I knew specifically there were going to be some people who asked for money but doesn't have you know, any kind of support or, grant writing experience, etc. But yeah.
All right, so next on the list is Stop Addiction New England. They've asked for 25,000. There's a score of 49 and a score of 40. Shelley and Counselor.
Hold on 1 second. I'm sorry, I'm just trying to get my stuff together. Okay. So did you want me to read kind of what they were asking for?
Yeah, a few
Okay.
sentences about the project.
Yeah, let me see here. Hold on. So this was the one, okay. Let me first say that this is the one that I had a hard time with their application because it was sent in like they sent us what we asked them to fill out. You know what I'm saying? So it was like I started reading it. I'm like, well, I don't even understand. They're telling me when they can post an application, and it's like the thing we sent out, they just resent it to us, and then they started with their answers to all of it. So that was kind of confusing, and that's one of the reasons I didn't give them a full 5 on that part of the actual application. Um, so they have wait a minute, I think they had 2. It's very confusing. Their project was going to serve about 80% of Bangor residents and 20% from Brewer. Uh, and the second phase recovery, stability, and harm reduction project is what they're calling it. It expands reintegration supports for individuals in their residential phase 2 program while strengthening harm reduction outreach for people in Bangor who are homeless, actively using, or disconnected from services. Their project addresses opioid related harms by reducing relapse and overdose risk during the vulnerable reintegration period through overdose prevention education, stable housing, supports, transportation assistance, and employment or training readiness. It fills a critical gap by providing long-term reintegration services, driver's license reinstatement, job preparation, housing transition, and ongoing outreach, resources not typically offered by detox, short-term treatment, or outpatient programs in Bangor. They also would have a work clothing or education trade school supplies for 8 to 12 people is who they're planning on helping with that. The driver's license was 10 to 15 residents. Outreach engagement would be at least 25 community members. I guess, does that help or should I find more? They plan, okay, so their 3-level, their high level project timeline is launch harm reduction education sessions, begin outreach to community members, initiate driver's license reinstatement processes, assess resident needs for employment, school, and housing, purchase clothing and educational supplies. That would be in the first 3 months. In the next 3 months, the next 6 months, sorry, continue harm reduction workshops, support 10 to 15 residents through driver's education licensing steps, provide work clothing, trade school materials, and essential living support, deliver outreach-based harm reduction service. And for the next 3 months afterwards, the 9 to 12, it'd be finalize employment education placements, complete individualized exit plans, and ensure stable transportation for residents, support transitions into housing, and maintain tracking of outcomes for reporting. So I guess it follows people from the time they start to not use to when like getting them back on their own, I guess, is what it's kind of like.
Now I pulled your scores, Counselor Hudson. It looks like the deductions are sort of spread pretty evenly, not anyone.
It was more just, I didn't think a lot of it was really clear,
Mm,
so.
Yeah, no, it was very messy. It's a messy application. Did you feel that way?
Mhm.
But like, I know not everybody knows how to fill one out, but sending us what
So
we
that
sent you
was
isn't right.
Right?
What was it?
He said it was scored pretty high for being messy.
Well, I took one off. Listen, I've never done this before, Scott.
You're doing great. Great.
Okay, all right.
So we have a 49, a 40, and a 44.5. Am I maybe hearing that this is another one where there's some consideration for going towards the lower score?
Yeah, I
Does
would think
anybody
so.
else- Is
Yeah,
everybody
it's
familiar with this organization? Because I didn't see the application or anything either. I'm not familiar with it at all.
Oh, the only reason I would agree with that is just because of what Shelley just said, and being in the same boat of being not super critical of anything. It makes more sense if somebody was being a little bit more critical, and it was a messy application with some errors that it should be probably more critically rated.
Are you familiar with them, Scott?
No, specific. That's what I just said. Specifically that one, I'm not. But yeah, I'm just saying, given the information on the table.
Are you familiar with them? No.
I mean, they did submit with their application many letters of recommendation. Is that right, Shelley?
they did have a lot.
And did they have a budget?
Um. I took it that they were not a well-known entity. Anybody can get a letter of,
Yeah, recommendation.
support, a
Yeah.
recommendation. And they were just trying to start somewhere,
Got it.
so.
Which might be the harm reduction sort of outreach piece
Right.
that you were talking about.
So it was really, it was for all of those reasons that I took off the 10 point.
Was it clear in the application if this, because the descriptions or the things you were listing off, and check me on this, Scott, is that those seem to me to be the things that you can't easily get public funding for. And so they were looking for kind of like bridge funding, but was it for the specific population they're serving now? Or for like an ongoing, if people coming in need that?
It was my impression they were hoping to be ongoing, but it's a long haul for them.
Yeah.
It's just because of who they are and their structure. Yeah. And like, Scott said, not everybody has grant writers and fundraisers. And
Scott
those
Party,
are-
it too looks like you might have been one of the recommendation writers.
It's like,
You might have been.
yeah, like Sue was saying, it's pretty easy to get somebody to write a recommendation.
Yeah, okay. I just didn't know if you knew more about them than I did or something,
Oh, unless it's another organization, who was it addressed to?
And does that introduce a conflict?
Yeah, maybe, but I don't even know, so, or at least by that name, is it part of something else, Shelley?
No,
On my,
not really.
Yeah.
No, and like, hold on, I gotta go through these first 10 pages of what we sent them, and now they're just sending it back to us. Here we go.
Definitely
It's a-
deserved -1 point.
Yeah. Well, maybe 10 now because there's 10 pages. Kevin McGuire was the project director.
oh, I know who Kevin McGuire is,
Yeah.
that's why.
Yeah.
So I do know something about him. He's a good guy, I can tell you that. I don't know about this organization. Yeah, well, that's a nice thing. So,
So did I hear us coalesce around going with the lower score?
That's what I heard. Where we
Okay.
Yeah.
The next one is Bangor Public Health and Community Services. This is a score of 42 and a score of 46.
Oh, geez. That wasn't me, was it?
It was me and somebody.
All right.
Actually, I shouldn't say that because I don't know who the other person was.
No, it was Chief Hathaway and Allison.
Oh. Oh no, because I ended up swapping one out. So that was one of the ones I swapped out.
A couple sentences on the project itself.
Yeah, this was the last one I did, so my memory is fuzzy. This was for to have somebody from public health stationed at Lebanaki, right?
Yes.
Lebanaki
Those
Health,
are on,
that road.
the other shoe building.
Oh, Deal, where Deal was.
Yes,
Oh.
yeah, yes.
Interesting. And I believe that was really the only use of the funds was to support that part-time.
Nurse practitioner?
Yes.
Yes. Work Lebanon in the facility.
That was helpful context. They talked a lot about wound care and then kind of one of the diagnosis piece of things that can't happen with the current staff that are there.
Yeah, I read it as a filling a gap. It's not currently.
Yes, they
Not currently
know.
available in the current one.
So there was very little difference in the two scores here. 42 and 46 for an average of 44. Go with the average. And I know that there has been conversation about not recommending public health receive any money. I think that probably conversation is for
Council.
Well, I think probably when this committee decides on what the final recommended list is based on this score, it's probably gonna score higher, but then we can talk through what that looks like with the recommendation to council.
Yeah, I was just looking at what I think I marked down on a couple of things. The most was the 3 for the rationale and data to support it. And my comment just says that there was limited statistics. A lot of the need was demonstrated through sharing observations of other providers that are working and have expressed need in that facility.
I just want to reiterate, we had talked about before we got applications, Bangor Public Health not applying. And I think the main logic that they did apply is because we didn't know how much money people were going to ask for and if we were just going to be able to fund everything. And I don't want to be a broken record. I've already said what I said about it. I really don't think they belong on this list.
Next on the list is community health and counseling services. I think this is one, Scott, that you're conflicted from, is that right?
I work at CHES, but I will keep my mouth shut.
Okay. We have a score of 37 and a score of 50 for an average of 43.5. Shelley or Counselor Hawes could give us a couple sentences on the project.
I wish I had my application. 37 for an organization that's been around a while makes me wonder why.
They're looking for funds to establish a supported housing model at Teresa's Place, which is a permanent housing initiative for individuals and families experiencing homelessness. Currently, they have temporary funding to support one full-time staff member. However, the staffing model must be strengthened to provide the comprehensive support necessary for a sustainable and effective program. Teresa's Place, I'm not sure if you all know, but it's uniquely positioned to serve individuals affected by opioid use disorder. Excuse me. Extensive research highlights a strong correlation between homelessness and substance use disorders. And so what they want to do is enhance their staffing and resources that they currently have now to be able to encompass more people. They're looking for uh, the amount requested from us was 50,000. The total would be the salary is 52,000 and the fringe would be 13,000 for the people they're trying to bring on, and 15,000 of that was going to be funded by CHCS, and that's why they were requesting only 50 instead of the 65.
And CHCS is the service provider at Together Place. They don't.
It's
run
Teresa's Place. Teresa's Place.
Teresa's Place, yeah.
Yeah, not Together
But
Place.
that's oh, I'm sorry, I misspoke. CHCS is just the services. They don't have the facility.
Penguins have the facility.
Right.
I think they currently have a facility called Teresa's Place, but
That's
in order
Penguins.
to, oh, is it?
Yeah.
I don't
So
know.
they're just providing, and it's the services.
Okay, I see.
Look at them.
So
Corrections.
their application was to the point. There was not very many pages, but they told us the information we needed to know, and I felt that like I scored them a 50 because I couldn't see why I wouldn't. None of those um, on the rubric, none of those 1 through 5s. They covered all of them as far as I was concerned. What did you have, Counselor?
They were spread over the whole page. And I will say that some of them, they may have talked about it, but they haven't really, they didn't really fulfill certain things that they have scored on in the past. And so it was some of that filtered in there. I was, and am still sad that Teresa's Place is not full. And, it's been a fair amount of time now that they don't seem to have the push to get out there and really get behind their workers and help them promote Teresa.
We placed some people, had some members of Fresh Start want to go to Teresa's Place, and one has been accepted. The application is 17 pages long. And after you're accepted, there's another 12 pages that have to be filled out. It's an absolute
Wow.
insane.
And that, I just want to point out, that process has nothing to do with the services being provided. What you're describing is the property manager side of it.
That is right.
So if that was weighing into the way you considered it, that there's barriers and there's dissatisfaction in the facility not being full, that would be outside of
But it's
the
still
control of
Teresa's Place.
DHCS.
Yeah, and I wasn't privy to any of that outside information. I just went by what was on this what was on this application. So
So we have a 37, a 50, and an average of 43.5.
I would be inclined to go with the 37, but the only reason I'm saying that is because Councilor Hawes has experience with them that we don't have. That's the only reason I'm saying that. But that would be up to the rest of everybody else.
Yeah, I guess I would be more inclined to go the average. I think I'm hearing experiences that may or may not be relevant, or a part of what's happening here is weighing into decisions.
Well,
yeah.
I lean towards the average, but I'd rather have the two folks that scored it.
What do you want to do, Shelley? You want to go to the average?
I'd go with the average. What do you think? No,
That's
what do you
fine.
want too, though? Okay, we're a team.
That's fine. I'll support it. That's what you want. It's fine.
All right, next on the list is the Bangor Y project. A score of 43 and a score of 42 for an average of 42.5. I think we do have one that was exactly the same. The project was, this was a Counselor Hazen.
I thought it was an interesting project. It's a project that we all know that they have a daycare. They're gonna have a more robust daycare center. When they opened the facility, this money was targeted for parents of those in daycare that are struggling with a variety of issues, including addiction issues. And I just thought it was an interesting program. It's certainly a sustainable, the organization we all know is sustainable in our community. I gave it a 42.
They did write a good for that program. It was well written. It's something that they excel at. And they normally will get what they want out of their programs. It covered the right things. I think the children of and the parents that have issues, it gives the kids a place to get some help as well. So I'm not typically a high score on anything. I never do all fives. I gave them a 43. So
It might have got one by that.
they might.
So
I
43,
just
42 average.
just as a observation, another thing that I realized is kind of a shortcoming of the way that we decided to score these things was there's very little consideration for the uh, agencies already having access to a vast amount of funding compared to others that don't. So I just kind of wanted to make that point.
And I thought about that, Scott, when I was reading through this, and yes, they do have access to a lot of other funds. But that was all done on a fundraising basis to get their new facility. I don't think that those funds are gonna be directly funneled into their programming. So that I looked at this as being an opportunity for them to add a new program. Yes, and a wonderful new building, but I gotta say, they went out and beat the street and raised the funds, the bulk of the funds that they needed for that. So, yeah, I get it. Because when I was reading it, I was seeing all the big signs that they had at the groundbreaking and the amounts of money. But there again, to your point, it's two separate issues.
Yeah, not all money is spendable the same way, I guess is my thought. There's the constraints, requirements.
Again, I didn't see the application, so I don't know about the applicability towards the thing, but I trust both of your judgments. And I just wanted to say it so it's said. It's something I think we need to consider. That's
Well, yeah.
Next on the list is Penobscot Community Health Center. We have a 40 and a 45 for an average of 42.5.
This was what I was talking about earlier when I was trying to pretend that I was talking about Bangor Public Health when I wasn't. This was the one that I had swapped out for. So I apologize.
A couple of sentences on the project.
Sure, they're just basically looking for bridging money to stay functional. I think so. The lowest thing I had them on was for the sustainability because they outlined a feasible plan to transition to a sustainable supportive housing model. However, the audit did mention substantial doubt regarding the organization's overall ability to continue as going concern, even though the financial improvement plan I'd already achieved 60% of the plan provided hires and implemented expansion savings. Um, again, it's like for me, this comes back to if it were like my opinion, I would have scored this much lower. Like if it was just my opinion on whether or not we're giving this money to a home, this transitional living program that's not specifically substance use disorder stuff. That I, if I remember right, their finances are terrible. Like they were like in debt. So like, but again, I just went through the rubric and whether or not they matched the things. My question was how my main concern, I guess, at the end of it, I didn't really write it down, was how applicable is this to this money? Like,
Well, I think that brings up a good point. Counselor Haas and I were talking earlier. Whether at the end of this process today, if it makes sense to run this through the city's legal department to make sure they're comfortable that the project next to the MOU that dictates how we can spend this money, to see if they have any concerns. With the defensibility of that decision. So this could be one, Scott, that we flag specifically for them to say, look
well,
closely at that.
it's like not related, but what's not related? Do you know
Yeah.
what I mean? I think what all of these applications was missing was a fifth column, 1 to 5. Does it make sense for us to spend this and why? But, you know, whatever.
Well, it's not measurable. It's probably why I didn't make the list. It's opinion.
Yeah, fair enough. I'm just saying, I'm just trying to make a point. I'm not, again, I have very little experience doing this stuff. It's just these are things that I'm realizing as we're going through this process.
So we have a 40, a 45, and an average of 42.5.
I'm good with the average.
Next on the list is Bangor Comprehensive Treatment Center. It's a score of 46 and a score of 38 for an average of 42.
You want to go first?
I have scored. Go for it. You've been quiet for a while.
Thank you. Okay, this is my only issues. I'm just gonna go over the issues on this, but, well, first of all, we want to know what they asked was all about. I gotta find it, so you bear with me. You have a.
I
Oh, no, you
do
didn't.
not, I only have my score. You can context clues.
Oh, didn't get that one for some reason. Okay, you read it to me.
I'm just gonna,
Carol, you have it.
I'm gonna search for it.
It's Discovery House. You might have it under Discovery House.
Yeah. Well, I just have your score.
it was specifically for scholarship funds. I don't remember.
It was. Anyway, I'll tell you what I scored. It was extremely long. It was over 120 pages, so it was impossible to get through. So I did not get through all of the 120 pages. So that brought the adherence to the application instructions to a 4. You know, the first 14 pages were just right, but jeepers, all the other data afterwards was be forever getting through it. The organizational information, I gave them a 4.2. There were no issues except that it was vague. Project description, I gave a 5. Priority population was a 5. The rational data to support the need, I gave it a 3. The data was out of date. It was referencing 2018 to 2022. And that's 4 years ago at the closest. So I thought that was out of date. the scope of work was not clear on the roles, on the roles of the staff. Data tracking was good, was okay, I gave that a 4. Sustainability, I gave a 2. The program is not sustainable without other grants or assumptions of increased insurance reimbursements, which are unlikely in the insurance world today. And the budget, they had a 15% indirect cost, which they didn't explain at all. So that brought me to the 38, which is what I gave them. It's a logical ask, and the number it may help is sound. So, you know, that's what I put for in my notes for a final score. So that's why I came up with a 38. And it's the Discovery House, in case nobody knows what it is. It's the methadone clinic out on Waterfront.
So it's subsidized or partially subsidized treatment for
Yes.
individuals who are underinsured or uninsured.
Yep, that was it.
And
How mu-
transportation.
How many people did they say that was going to impact? Do you remember?
That's the only one I didn't print. Somebody didn't have with me, unless you got it.
I'm looking to see if I had comments about if that was there.
I may have it here.
It's a larger organization and it was very targeted, and I just have a lot of notes about how they were very skillful in carving out specifically what would apply to this funding and this purpose. It was long, it was their organizational report, which was a little overdone. It wasn't information that I needed. And I kind of interpreted it more as a way to demonstrate their awareness of the industry and the work that they're doing. They spoke to doing lobbying work or being some way involved with legislation that would push for expanded treatment coverage through insurance. And they saw this as a way to help people that needed the help right now, that they'd have to turn away if they didn't have.
It was a transportation thing, wasn't it? Mostly.
There was, I have it down as scholarships
Yeah.
for
Is that what you
services.
showed?
And I think a lot of them had a little bit of transportation. This might have been one of them that did, and I think I don't remember what it would have been for.
Yeah, that was.
Yeah, it looks like they plan to enroll 9 to 15 participants for the financial assistance. And then they don't really spell out how many people will get transportation assistance, but it just says distribution of bus passes, gas cards, or Uber health rides.
Okay.
And my markdowns were largely around sustainability and then also the rationale.
Average.
All right, the next one is Crosspoint. And this is the one that
Is that the mansion one or the other one?
Scott Knowles and Scott Hardy.
Yeah, which one is that Cross Point? I have it here.
It's the men's program for the mansion, the men's discipleship program.
Did that one get distributed twice?
I have the
Yeah,
mention here somewhere.
Yeah, because I was a part of. Crosspoint is confusing. I had Shepherd Godparent Home
Yeah, I had that one
Cross-
too.
showed up in the list for this committee. It wasn't referenced anywhere
In the
in the
application.
application.
Okay.
Oh.
So the one that Shelley and Allison scored should be listed as two, and it should be 5 parent home.
Yes.
Okay, so Cross Point 1 is the Mansion Church.
Yep, and the men's
Okay.
treatment. Yep, okay. So that was a score of 44.40 for an average of 42.
Yeah, my
Okay.
low is, well, yeah, it's whatever. That's pretty close.
Yeah, average is
Yeah.
close. I, let's see, there was no data, I gave them a 2 on the rational data. Because there was no data given. The timeline was vague. It's feasible, but it's vague. And the budget, there were minor gaps, and I felt the estimates were low. So that was my only low scoring part of that. But the average is fine. Are you good with that, Scott?
Yeah, it's basically you're saying the same thing that I'm saying. We just scored it a little different, but that was the same concerns that I had.
Yeah. Okay.
All right, next on the list is Generation O. Score of
That one
40,
was one of mine.
a score of 44 for an average of
So,
42.
whoops, that's the wrong thing.
What was Generation O?
So this was one of the ones I was talking about that if I like could make a magic wand and just disappear it, I would. Primarily because it's sending all of the money out of our state. So the person who's the nonprofit is registered in like Florida. The person lives in Colorado. It's a cool program. It's like neonatal attention, education to new parents who with babies and or children who are born addicted. And it's like a set of like educational online courses that they can do. And then so like I think it was like 7,500 of it was like for the salary for this one person who's going to run it, and the rest of it was for like awards they could get through points through completing these courses for stuff for their kids. The only reason I really
Hmm.
didn't like it is because it's sending all the money. I mean, I guess not. The items are coming back to the families for completing these courses, I guess, but
So I guess we just have to score it, but why are we considering?
Well, so it sounds like it will be services provided to Bangor residents by a
yeah.
service provider that has no connection to Bangor.
And they want 20,000, and how much was just for salary? 7,500, so
7,500, yeah.
yeah, so 1/3 is automatically going away,
Mhm.
and 2/3, who really knows?
Well, again, it's supposed to be for like awards for completing this thing. There's just like aside from that, it's like also I don't know. The application said they had like 8,000 caregivers, and I was trying to do math on that in my head. So you've got one person primarily doing this, and they're going to serve 30 people per $7,500 that they're asking for. And then how many hours per set of 30 people is that? If you've got 8,000 caregivers, a community of 8,000 caregivers is what for their like support. I don't know. I just think really in general, it's sending the money out of the state. We need money here for the programs that we already have. So again, I would just, if I could wave a wand, I would take it off the list.
Can we do that?
I think that's why we're here, Aim, to make recommendations on the things that make sense and the things that don't.
I'm just reading it, I just Googled it, and it is a national organization, but it's all the money's going out of state. I don't even think, can we vote it off?
The money's not going out of state though, is what I just heard. I heard there's a,
There it is, and then
well,
who knows about the rest? Kind of sounds like a scam.
So I mean,
We should consider
so
it a low-
basically the specific, oh, sorry, go ahead.
I think if we're not comfortable with this, we should go with a low score and then have legal look at it from their perspective to make sure that it meets the guidelines.
Got it.
That would be my recommendation.
I won't get-
If you read this, it really was written and pulled at heartstrings because it's NICU kids that are having the issues from the addiction of the moms. But that aside, I've worked up there in that unit. And it's very difficult to get them to accept somebody to come in and work with the families and send the stuff. So I'm like him, I didn't have a whole lot of like rah, but I think you're right. Go with the low one and we'll look at it. And then just.
That was like, that was like also a concern of mine because this person who's getting paid to do this is basically administrating it and then like getting the hospital to refer people. and then it's all online. So it's almost, and they don't have any commitments from of partnership from these people they're saying are going to send the referrals, which would be like imperative for them to be able to do what they said they're going to do. I don't know. I just had lots of question marks with it. Anyway, I digress.
And without getting into specifics of this, is there a requirement or expectation that the organization is in Maine? Because I wonder if that impacts
It
other
was
people's
my understanding,
eligibility.
the way I read it, I don't think they're here yet. They don't have a director yet.
So taking
But
this specific project out of it, is the expectation of this funding that the organization receiving it be established and in Maine?
I think there definitely should be a preference for our programs here before we start sending money out of state when we really need it here, right?
We need services here. I'm just
That's
wondering if
true.
other entities on this list would also need to be looked at differently if they're originating out of state.
Yeah.
So not having any opinion at all about this organization, we need to be thinking of them all equally as far as being eligible.
So I
I
think
feel like
the way
it's
it was
in the application somewhere, isn't it, that it has to be in Bangor? It's almost like
Yeah.
it was too much of a requirement when I read it. That's why it's sticking out of my head because it's like almost like it said it had to be in Bangor when there's not a lot of stuff on this list that's all like in Bangor, but surrounding area stuff. Let me see if I can find it so I'm not just talking out of sight.
I believe it was with respect to the people served.
I
Needed
second
to
the
be.
legal piece. I just want to make sure that we're not misscoring others.
Well, okay, so eligible applicants, Maine-based organizations
Okay.
providing services in the city of
So it
Bangor.
does say.
Yeah.
So they actually wouldn't be eligible.
Right.
They're not being based. They're
No,
providing
Colorado.
services here, but they're.
I want to say there was something in the application that kind of blurred that line, but when I looked at it, the nonprofit was registered in Florida. The person lives in Colorado, so
So let's take a note that says legal review, specifically, are they eligible based on that Maine-based criteria?
I was just like, honestly, I was just can't. I was like thinking, can't knock that hustle. How many people got opioid money? You send that out to every city all the way across the country. Holy!
It sounds like a scam, yeah.
I wouldn't say a scam, but it sounds like a good business plan.
Yeah,
Are we using the law school? Until we
So-
find out something.
yeah, we'll keep the low score unless anyone tells me otherwise, but we'll specifically call out Google to look at that. Next on the list, St. Andre Home, $10,000. There's a score of 48.36 for an average of. This was Chief Hathaway and Scott.
Oh, what was this thing? Sorry, one second. I'm trying to pull it up. I think it would be good to hear what the lower score critiques were, because like I only had two things that were four, and everything else was fives.
So, St. Andre Home is a longtime provider in our community. However, in this instance, I found issues with their budget and sustainability and their rationale for this particular program. I understand it was $10,000, and I would be pleased if we were able to find a mechanism to award that $10,000. However, if I use the same scoring methodology that I use for every other, then that's where I've struggled with their budget and their sustainability for the two primary issues that I had concerns with.
I did say that was one of the things I had marked before was the budget because it seems like they were kind of overstating the feasibility of goals based on the amount of money that they were asking for. So I can agree on that point. The other thing was the scope of the work, which is also what you just said too, right?
Yes.
Yeah. I was just significantly less critical about it.
I think we had a like-minded approach on this. I think the average is probably reasonable.
Next on the list is Bangor Area Recovery Network, a score of 36, a score of 47, or an average of 41.5. Scott and Scott.
Actually needed to revisit that score because you'll remember I had asked you for extra documentation based off the rationale, and I did not update the which one was it?
Yeah,
The
you
data
asked for-
tracking. So that would have been a 5. So it would have been a 49. Because
Okay.
basically in the state, sorry, I would say 4 because I had to actually go seek out that information. So it would have been a 48 because they had said that
Okay.
that information already existed in different paperwork, and I had to go find that paperwork in order to find that information. It wasn't in the application. So it wasn't perfect, but it did exist and it was good.
So that would take
Would
the
have made it a
average,
48. Yeah, I'm sorry.
would have made the average of 42 instead of a 4.
Okay, you wanna hear from me now on the low score of what I found?
Could you just give a couple sentences first on what the project was?
Yeah. You're gonna make
You want me to go? So
Yeah,
it's just basically they're just trying to complete the stuff that they got awarded the ARPA money for. They had been
That's right.
awarded money to do renovations and then were unable to achieve those renovations because either they underestimated it. I think their explanation was things got more expensive, which they did over the time period of when they were trying to implement it. Yeah, that was the gist.
Okay. Yep, okay, so here's why, okay, the project description, although the project is necessary to the barn, the ask is to cover a shortfall from previous funding and the ARPA grant. So that's why I gave it a 2 on the project description. The rational data doesn't align with the ask to cover the shortfall. In my opinion, of course, some of this is opinionated. The scope of the work is vague on what the funds will pay for, as this is for a shortage from the ARPA grant. So there was no detail of what they were short. It's just an ask for a bunch of money. And believe me, I'm a fan of the barn too. So this came difficult. And the budget is very basic. The original ARPA grant would have to be looked at to score this any better than a 2 on the budget. So that it was for me, it was mostly that it was a very vague. There were no details on where the money was going to go. It was just to cover a shortfall, and that's why I scored it.
I mean, how many, do you remember how many documents you got? Because I got like 1, 2, 3, 4, 5, 6, 7, 8, 9 for that one. And I have a specific breakdown of a budget.
Um,
And even I
uh,
think inside the application, they said when during the question of can you take more or less, they had elaborated on how that would work based on
yeah,
what they
that's
needed
fine.
to do with the money.
Correct. If they could take less, that's fine. But I gauge this on what I know about the barn and also from what I heard from management at the barn who who called me on it. So I, I had an inside track that they feel that it wasn't a comfortable ask, but they had to ask anyway. And I believe they got money from the county too. Is that right?
Well, the ask was for half of what they actually needed because they needed, I think, actually just a little over 100, which was one of the things that I scored a little bit lower on because they need both funding in order to make it to fully realize it. Um,
Yeah. No, that's
However, they
just
did
fine.
say they could scale it down if they needed to. I'm trying to find that.
That's how I scored it, Scott, anyway.
Just to be clear, the money that they received from the county is for something different.
Okay. It wasn't to cover a shortfall.
No, for integrating peer recovery support into the emergency department at St. Joseph's Hospital.
Okay, so and again, this is one of the things that I graded it down on because it said I thought it was they asked for the other half from the county, but in general, they said due to rising inflation tariffs impacting construction and material costs, we have over a $100,000 shortfall, and they're asking for 50,000, so that really only covers half of it. But they did say, where is it? It could be scaled up or down based on the amount of money.
So where are they gonna come up with the other? Anyway, that's why I scored it the way I could.
So you scored down on the sustainability part.
I scored down on the rational data. I scored down on the two. I gave him a 2 on the project description, although the project is necessary to the barn. The ask is to cover a shortfall from a previous funding ARPA grant. So that's why I gave it a 2. The data tracking was good. The budget was very basic. It didn't outline exactly what the money was going to go for, except for the shortfall. So that's what brought everything down.
Well, it's like again, right? Like what I had in budget was the budget is exceptionally documented, including an original ARPA budget of 495,600 contractor bid tabulation, and then a post bid assessment showing a current deficit of 104,000 after the fact. So that information and breakdown was in there.
Okay.
TV Scott knows. Was it evident to you that there was some sort of plan to maybe fundraise or get the rest of the money elsewhere?
No, and again, that's the one thing I scored down on because they were at, but again, they couldn't ask for 100 either. That's all they could ask for was 50. And they did say yes, they could with less money. So if you can pare it down, then that means you can do it with less than 100,000, right? I would also say, Bangor Area Recovery Network is one of the hugest hubs for recovery in our area.
I'm a fan too, but I had to go with what I had to go with.
Well, it sounds like
Fair
you
enough.
went information that TV Scott didn't have. That
Perhaps.
was insider information, which
Yeah.
probably should have been disclosed to begin with.
Maybe.
So what am I missing?
I think what you're missing is you only had access to the official application. Where in the room, Scott is saying he had direct communication with people involved closely with the program.
That makes my brain hurt a little bit. So I thought we were grading the applications.
We did. I graded it as it was by the rubric.
So I'm sensing maybe some interest in favoring the higher score, since that was based on the face of the application. Is that
That's what I think.
a correct read?
That's what I would say, yes.
Choose between the low, the high, or the average. It can be some other number as well.
That would kind of want to bully you and the people that were doing the scoring be the one that make the decision, but it feels like one scores based on what was provided and one had extra details, which maybe those details were left out of this application for a reason that we don't have.
Or I didn't know either, right? Why you left it out, I don't know.
Right.
So that leaves us with one score.
Okay. Go with the higher
Yeah.
score.
Yeah, whatever you guys.
What's
decide.
that?
They're
What
going
did you
with
say?
your
I'm sorry. Okay, yep, that sounds good to me.
Any objection, Shelley? I don't mean to ignore you. Okay. Next on the list is Blue Sky Counseling. We have a score of 46, a score of 37, for an average of 41.5.
Right at this moment in time, I can remember nothing about Blue Sky Council. And I don't have it with me, so.
Scott Knowles, any recollection?
Oh, mouse.
Oh,
Misbehavior.
Hallelujah. Holy wireless mouse supposed to make things more convenient, does not, for the record. So basically they were looking to fund 3 to 4 full scholarships for treatment over time. That was my major beef with it, was like, that's a lot of money for 3 people. I mean, treatment's not inexpensive, but still, that's kind of a, what do they say? It's like the impact per person per whatever. I forget what that is called, but you know what I'm saying. Let me pull up the actual scoring rubric so I can tell you specifically. And again, right, like just not to sound like redundant, but I feel like that was kind of the shortfall of the way that we graded these, is because by the letter of what it was asking for, a lot of the check marks were made. However, it's still like doesn't seem like a great idea to me. Oh, come on. I apologize. You guys want to move to the next one and circle back because I have to like fix my mouse. This is not working. Oh, of course I say that and then it opens. Just kidding. Okay. So the budget, realistic based on existing successful models. The cost per participant is high due to comprehensive services, but it's like I said, that's basically the same thing I said. The sustainability transitioning clients to long-term sustainable options like main care or private insurance is good, but there's no evidence of building partnerships or engaging community partners for long-term support. The project description is highly detailed and evidence-based. The anticipated number of unique individuals served is relatively small given the large request. Lack of a funding to support MOUD for the uninsured, large request for small number of people. So basically the same thing I just said 3 different ways. Sorry.
So Counselor Hawes, is that pretty reflective of what your scores?
Actually, I scored them considerably lower than he did. But I think there were some of the same areas. I just went from a different angle. I mean, there's only so many things you can score them on.
I think we've decided to call that one style. You have the same, I pulled up your.
I'm honestly okay with leaning with the more critical scoring, specifically because that's a tiny number of people to help for $50,000. So, but that's just my opinion.
Sustainability.
Yeah. Well, for that amount of money and that number of people, you are just sustain it.
Those were three slots, so
3 to 4 people.
So I think what I heard, Scott, was that you said that you maybe even preferred lower score.
I'm okay with going
Or
with the more critical score unless anybody has an objection to that.
Okay. Next on the list is GBA counseling services. We have a 33 and a 50 for an average of 41.5. Shelley or Chief Hathaway, couple sentences on what this one was.
Do you want me to go, Chief?
Sure.
Okay. So basically what they're looking for is funding to allow 12 more individuals to access immediate and critical treatment via both telehealth and in-person formats. And it would be people with substance use disorder, opioid use disorder, and co-occurring mental health and substance use disorder. And be people who are uninsured, which sounds a little bit like the last people. But they are looking for 30,000 to be able to do that. And their money would immediate lease a 3 office unit space and hire an additional licensed clinician to be able to bring on 12 more clients. I do have a question though. They said the request is to build on their application for opioid settlement funding from Penobscot County. So I didn't know if did Penobscot give them an amount?
Let me take a look. They did.
Okay. Were they asking the same amount? How much?
Gave them 35,000.
Oh, okay, okay. So I guess
What I
then
have is
whatever, okay. So I guess then whatever we would add would be added on to theirs. I personally think helping anybody who's uninsured is uninsured and maybe unable to get main care. I think that that's important to help those people with their treatment as well as counseling and stuff. Uh, I will say that I didn't um, I didn't grade low because I think that what they're doing would be great, and to me their uh, application is an easy read. They did have a lot of letters of support, but like you said earlier, there's anybody can get those from anyone. Um, so I just felt like this was an important part for the community of Bangor. Go ahead, Chief.
I had issues with sustainability and budget.
Okay.
And with their, with the description of their organization and the service they were gonna provide. But as I look at my scoring, I was fairly consistent. Sustainability and budget were my two issues.
Hmm.
We're quite a bit off on our grading.
Well,
I
it's
think
because
we-
I'm a
I think
bleeding
it's a step
heart.
You know,
Yeah, if we could do maybe the average.
yeah, I'm comfortable with the average. I don't
Yeah, me
think
too.
Tire issue, not a program issue.
Did you mean sustainability beyond the plan that they have for the amount of time or during the
Yeah,
time that they plan?
I also had a timeline issue.
Okay, okay. I was just re-looking at that and I kind of was wondering about that because I don't see it either. Yeah, I think if we split it down the middle.
All right. Don't go away, Shelley. So the next on the list is Metro Treatment of Maine. There's a score of 50 and a score of 33 for an average of 41.5. Same scorers, so likely the same style.
Is it still me and the chief?
Yes.
Oh, geez.
Need to find that. Remember scoring that, and I will tell you that my scoring on that aligned with the previous. I had
The same.
yeah, I had some sustainability issues with it, and without looking at my score sheet in front of me on my phone, I had a timeline issue as well.
Yeah, I don't see
You have my okay.
yeah, I don't see a timeline very well clearly outlined here either. Yeah, we could go half again. Or like split the difference.
Did anybody say what that was for? Is it similar?
Oh, I'm sorry. Shoot. Hold on. I just threw my papers before. They were looking for project description. Proposal directly addresses the harms of the opioid crisis by expanding access to evidence-based medicine, medication-assisted treatment for individuals who might otherwise be unable to obtain care by providing financial support through treatment scholarships. The project reduces barriers to initiating and sustaining MAT, and the project also supports earlier engagement in treatment following overdose or crisis, helping stabilize individuals and prevent repeat emergencies. As clients enter MAT, they also gain access to counseling, recovery supports, and wraparound services that address the social and behavioral factors contributing to opioid-related harm. So basically, but it didn't really say like how many people. Hold on.
I'm just curious what the.
Yeah, it's for Matt, but like services beyond Matt. But once you start Matt, you get these services.
All right. Next on the list is Preble Street. We have 43 and a 39 for an average of 41.
We're both low scores, aren't we?
Go ahead, Scott.
What was the project?
I'll read it to you. Preble Street requests funding to support the Hope House, the only facility in Bangor that provides low barrier emergency shelter for people experiencing homelessness, SUD, OUD, and co-occurring mental health disorders. Funds will support people in their transition from homelessness and active substance use to stable housing and recovery. That's the basic part of that. And I support this. Whoops, somehow. Here it is. The low, we scored about even. My issues were the organization, information, the description. I'm personally familiar with Preble Street, but if I wasn't, it might be hard to follow, so I gave it a 3. And the goals seem to support the existing organization with nothing new and very general goals and outcomes. That I gave a 3. The scope of work, I gave it 3. Scope of work is an ongoing and what they currently do. Sustainability is a 3 because the project requires ongoing funding to maintain anything that the Hope House does. And that's where I came up with that. And we were right close on that.
Was it general operating or was it a specific yes need?
Which part? I wasn't listening.
That's okay. For the funding, is it just general operating?
Yes, correct.
This was where my observation about directed and correct.
So pretty close. An average or
I'm okay with the
Yeah.
average. Okay.
next on the list is Timberwolves. We have a score of 32 and a score of 50.
Who had 50?
Shelley.
Timberwolves. Oh, you part of you know her.
No, it's important that this isn't a public session, so
It isn't.
it's
No.
not. I mean, it's public for viewing, but not public participation.
You could give the
Yeah.
description.
Yeah, I can. So actually, it's Timberwolves Native American Church is the requester, but it's for a program called the Bangor Community Wellness and Prevention Program. Hold on. Short bios, project. Okay, so the project Bangor will that is actually program. It's phase 3 of that program. This location is at the Brick Church. The Community Wellness Prevention Program 3 expands upon the successful foundation established during the initial pilot. Phase 1 demonstrated a clear community need for trauma-informed prevention services, culturally grounded healing opportunities, family wellness, education, youth-focused supports, and accessible harm reduction training. Phase 3 strengthens and enlarges the work by broadening program capacity, deepening prevention supports, expanding targeted workshops, enhancing culturally rooted wellness offerings, and introducing a peer wellness leadership component that builds long-term sustainability. So this is to support their program, the phase 3 part of it.
You want me to tell why I scored?
Yeah, go
13,
ahead,
Michelle?
go ahead. Yeah, yeah.
Okay,
This is
the,
something that-
I felt the adherence to the application instructions was off, and I'm giving it to, the reason is there were 3 applications, was over. I can't remember what the rest of it was, 3 applications with different asks, it was a little confusing to me. The project description was very broad, and somewhat hard to follow because they had these phases, these 3 phases. The project timeline, I gave it 3, was well thought out, but parts seemed unrealistic. Scope of work does include key activities and a lot of uncertainty about how this will all work. And sustainability requires receiving grants only to be sustainable. It would have to continue to receive grants to be sustainable. And the budget, I thought, was incomplete and the proper allocation was vague. So that's where I kind of came up with a low score. It was, so that's me on that.
Yeah, they did spread it out in each month, what people would be, what the plan was. Did you see that?
I
Did you
did,
say that,
uh,
did you say that wasn't like
uh,
precise enough or?
timeline was well thought out.
Oh, okay, okay,
But
sorry.
it's unrealistic. Parts of it seemed unrealistic.
Okay, unable to achieve, is that what you mean by unrealistic?
Mhm.
Yeah, um. I guess looking at this one, the total budget that they're requesting, they did put out what it was for, but it is kind of vague, as you're saying. Um, they list some things that it's for, but it's not like pinpointing, you know, this one covers teaching supplies, printed materials. It doesn't really, that's $6,000 out of the money that they want, but they don't really specify what uh program they're using or like the teaching supplies, stipends for facilitators, wellness educators. That's some of the monies. Yeah. Um, what would be the I'm looking here. Yeah, I think we could go with the split. But also, you know how we were gonna like be able to give out money, but we would give lower amounts to people if we couldn't do the full amount. Is this someone we consider that for, or is this a different step of the process later?
I think that's a different step of the process. We just got to do the
Okay,
scores
okay,
first.
okay, all right. Then we can
I
go
can
with
take a note that you're interested in considering this for.
part of it. Yeah, part of it, but not the full amount. Scott, are you okay with going the average score?
Yeah, I'm okay with that, sure.
Okay, all right.
Okay. Next on the list, Wabanaki Public Health. We have a full agreement, 241s. What was the project?
I'm gonna have to look. I did bring that one. Oh, there he is. Oh, okay. It's for the Cedar Road detox. Cedar Road detox plays a critical role in addressing the harms associated with the opioid crisis, providing safe, evidence-based withdrawal management, rapid linkage to treatment, stabilizing support for individuals at high risk of overdose and related health complications. I'm very much in favor of the 2 detoxes we have. One is Wellsprings and the other is Cedar Roads, and 41 is a high score for me to get. So I can tell you. We probably had the same things, chief, anyway, I had no issues all the way down, except for the rationale, data to support the need, there was a lot of assumptions. Sustainability, no steps or specific sources are given for sustainability, and the budget is a narrative only, and that was my only issues with it, but I personally think it's, like I said, 41's a high score for me to do.
So we'll stick with 41.
So let's achieve this.
No, I found their budget and their description would be very good at a timeline issue.
Yeah.
With the project, but 41.
All right, EMDC is next on the list. We had a 40 and a 41.
So
Yeah.
We called each other.
I think maybe we didn't know.
No, we did not.
No, we didn't.
You say that very loud.
It's right here. The MDC Recovery Support Workforce Pathways Program will strengthen recovery outcomes for Bangor residents by addressing two of the most persistent barriers to sustain recovery, employment stability, and access to essential support such as housing and transportation. Anyway, I gave that, like I said before, 41 is a pretty high score. Here it is. I had an issue with the rationale, the data to support the need. I was a little low on. Sustainability lacks details, and that was the, I think the budget was clear and detailed. But even when something's clear and detailed, I give it a 4. So just so you know, I don't believe 5's too much. Unless they're cut and dry. So that was it for me.
Can I ask a question? Did they connect the assistants to the target population?
I believe they did, yes.
So they're gonna offer those services specifically to folks?
Correct.
They did, okay.
They did make reference to that.
Yep.
Sorry to interrupt.
I'm good with 41. I found the project description to be very, very well done.
Yeah.
And that was fairly average on versus all the other schools. Yep.
So take the average of the two.
Please.
Fresh Start.
Do you want me to leave? I can leave.
I think we just need non-participation.
I'll shut up.
Because other
I'll look at my-
applicants can be watching online, so I think it's fine for you to stay in the room.
Okay, I'll read my email.
So we have a 38 and a 41. Pretty close.
Go for it, Allison.
This was also for scholarship. I have to look this way, not this way. For individuals looking to enter Fresh Start. It covered a little bit, I think it was the first maybe 2 months, 2 weeks, I don't remember. It was a very specific and yeah, there was an end to the scholarship value, and then there was some administrative funding that was associated with it that was partially being covered by Fresh Start outside of this. And it was a single purpose. It didn't have a lot of, it was very clear.
It'd say how many people it was going to impact.
Hold, please. I don't have information about that, TV Scott, but I do say that it did not indicate that the scholarships would be reserved specifically for residents of Bangor, just that the houses in Bangor. Other things that I marked down on were sustainability. It wasn't clear if this was going to be an ongoing fundraising effort or just a one-time pocket of money. And the other thing was, nothing was included for data tracking, which was the primary place that they lost. It's with me or with my score. And then the data was largely county level, not Bangor level.
Anything to add?
No, should cover.
Good.
Good with the average. I thought so.
I'm assuming, I'm wondering if it did because I didn't mark it as not being there.
Yeah.
And that was something I was
I think
looking
it was in there, it's just. It's not in here, right? All right.
Next on the list, Needlepoint Sanctuary, their first application scored by, or what's marked as their first, Scott Hardy and Kessler. Pretty
Want me to read
close.
Yeah, go ahead.
Read the project description, the, excuse me, the over. It's quite long. Essentially. It's a really long description and I read it once, but it was weeks and weeks ago now. Okay, yes, okay, this is for the syringe rebate program. It's like the bottle bill. People turn in syringes and get 5 cents or something like that. I believe it was 5 cents. And this is how I graded it. I had no issues with the application, the project description. The project needs refinement around location and how it will, how its operations will take place. Only one okay, rational data to support the need. Only one source was given, and it was an article out of a magazine.
Can I just
Project
raise a question real? Can I raise a question real quick? You said they were going to encourage people to go pick up needles.
Correct, that's what it is. It's like a bottle bill.
Okay, can we do that legally where there's an HIV outbreak or encouraging people to go pick up dirty needles? That's crazy.
Is it picking up or is it just returning the ones that they?
Returning, but you know, and I know they'll pick them up too.
Yeah, I mean, it's a great idea if you want to clean up all the needles because people are going to do it. It's a terrible idea because at least somebody's going to get hurt doing that. That's crazy.
Start, yep. I'm not saying it's a good idea. I'm just going on the rubrics of how I scored it. Let's see, okay, staffing roles need more refinement. I had no issues on it. Okay, the budget, it's realistic, but it needs more detail. And I gave it a 40, and I think,
That's high for you.
yeah, we were right there, right? Yeah, we were right there.
To be less bombastic and more specific, I do think that's something we should ask about is whether or not you can actually implement something like that because of the gigantic risk for somebody to be harmed because it may just be invalid altogether. At least it seems like that to me. I don't know.
And send it to legal.
I mean, one of the requirements is that you were describing evidence-based practices. Do we know that to be an evidence-based?
No, as far
Practice.
as it working in other places, I think they had some whip in here that another place was going to try it, but nobody else had. You know, I think it was another location in Maine too, in southern Maine,
Yeah.
that was going to do it,
That
and
sounds good.
but they hadn't done it yet.
So there might be rules in the
There
funding
may be.
itself that would
Yeah,
be
we have it.
prohibitive anyways.
Correct, yeah, it's, I don't know, I scored it based on the rubrics. That's how.
Well, I think that's a limitation is that it doesn't
Yeah.
take into account
Right, doesn't take into account, so.
humans.
Yeah, right.
So I've heard that we definitely want legal to review the permissibility of the underlying program. I think I'm also sensing with this one, maybe some interest in going with the lower score.
That's fine.
Or I could be misreading the tea leaves as well. I don't wanna.
Lowest, because there's only 2 points difference between the lower score and the average. So averages or lower score.
I don't care.
Well, it might be more.
Okay, let's go with the average.
I feel like most of the things in white should just almost auto average because that means they were close. So
Yeah, we
Yeah.
were close.
Okay. Average. Okay, now we're into the common ground 3 applications, which can get a little confusing, but the first one on the list
yeah,
is the
that's
one
me.
that was. Well,
Or I
no,
was one of the people
no.
for that. No, it's
So-
not. Just kidding. It should be because the score is 43 and I got a score of 43 on it. So
Oh, this, I didn't change. This was one that got swapped.
okay.
Yep. Because of the conflict. So Scott and Counselor Haas.
I think this would be amazing if we had money to waste.
What is the
That sounds
project?
terrible. Basically, they made a documentary about homelessness and how it's impacting our area, and they want $50,000 to go around and show it to different agencies. Like if we had money to waste, that'd be great. But we've got a lot of people who need money to provide services. So and the thing is, right, like it scored a 43 because it hit a lot of the marks. It was the things that it said it needed by the rubric. However, this was one of the 3 that if I had to pick to disappear, it would be gone because it just seems like we've got more important things to spend this money on.
I agree. The application did hit the marks that it should in a lot of places. But I agree with Scott on the, investing that in a movie that's gonna take around and show doesn't help people. So. And I don't care. You can use the.
Yeah, I'm good with going with the lower score because it's obvious that I would. Yeah.
All right. The next one on the list is Godparents Home. And Shelley had a 50, and
There's a couple of points between us, Fred.
I had a 13.
So, they were looking for money to make, did it say 3 or 4 extra rooms? Beds, also for treatment programs for people who they already have people that go to this Shepherd's Godparent home. But they wanted to increase the amount of people they could service. I'm looking at it, and with going with what Scott said earlier about how many people it'll actually help and how much money it actually is, seems to be upside down. Like it should help more people than it is for that amount of money. And they wanted what they want, 49,000, was that the one? Yeah, $49,600. So I got to give that part of it to you, Allison. I'm sure that was involved in your scoring.
Can I ask a
Um,
clarifying question?
Yeah.
Are we talking about expanding rooms so it means there's 3 or 4 more people consistently being helped moving forward, or just 3 or 4 people, period? Because that's a different number. Do you know what I mean?
Oh,
It actually
what
might
do you?
be clear because the project description talked about existing capacity to serve pregnant and parenting mothers. And then in the timeline, it talked about needing to lease
Space.
the space for it. So
So
a
again, it
lot
would
of
only be for the lease. Okay.
so I mean, at 13, the markdowns were across the board, obviously. I think if there had to be a large theme, it was that the funding to me, from my perspective, for a treatment supportive residential program was very low for 40 units. And they didn't actually reference any type of treatment. It really seemed to be providing shelter, which is a different level of support for people who are have custody of their children and are in recovery. So it didn't seem enough to me. It also didn't really share any evidence-based practices. And I noted that the only potentially recovery-related supply in the budget was for drug testing. So I didn't see where we were talking about any kind of
Well,
Narcan or-
you're right. I see though where it says hire and onboard a part-time recovery coach, certified peer mentor. Prepare the 4 bedrooms and women and children affected by opioid use.
It was
Purchase
gonna do.
supplies.
It was gonna do all that for how much? 50 grand? Is that what they asked for?
Yeah, it was purchase
They were
supplies,
gonna
recovery
hire
materials.
somebody and expand 4 bedrooms for 50
That's what
grand.
they
Yeah,
said.
it was residential services, treatment services for 4. I don't know if it's specified in recovery or just OUD impacted mothers and children, plus a part-time
Recovery coach, right?
recovery. It was a peer support model.
It's unfortunate that they apparently didn't represent it very well because I've got some like lived experience and I guess it's not necessarily personally mine, but things I've witnessed, people I know who've gone through the program, and they definitely do help lots of moms who are going through recovery and stuff. So it's unfortunate that they didn't reflect that in their application. However, that seems like, how would you do that? Just hiring a peer support is going to be the majority of that, and then you're going to expand 4 beds for how long? For I don't know, whatever. This is my 2 cents. Sorry.
Yeah, they were looking to use the a lot of the budget actually wasn't that peer support, and the only thing that stands out to me is it was $20 an hour was their rate. I didn't see any fringe or anything, so I'm not sure if it was ever going to be a full-time position. Yeah, that's my point.
All right. So we have a 50, a 13, and an average of 31.5.
Oh, you know what, Scott? It says that they would serve 60 women and children over the grant period. So I assume that's an in and out kind of thing of
Well, it's
those
like
4
it's again,
bedrooms.
so you're gonna serve 60 people for that. Doesn't seem like the math is mathing. Seems
Yeah,
like bad
okay.
math,
Yeah,
which is
I
unfortunate because
interpret
they're good people, they do good stuff, but it doesn't seem like they represented or made a reasonable
And see, I
unfortunately.
don't know that stuff. You know what I mean? I don't know that mathing.
the peer support was going to be providing services to those 4 new units, and then it sounds like they were also going to be used in their other locations. So this was going to introduce dedicated peer support staff to their programs overall, with the portion of that individual being assigned to the new units, wherever they were. Or rooms. I think they described them as rooms, not units. But it definitely also landed more, the budget and the description lined up with meeting the homelessness needs more than the OUD.
Which
The
is
recovery part.
100%, like the key thing that they're doing. However, there is definitely some crossover. So, like I said, just unfortunate they didn't represent that well. Yeah, I don't know. I just one more thing and I'll shut up. I think with a gap that large, you kind of have to meet in the middle. That's just my opinion.
Yeah, I'll do whatever you want to do, Allison.
No.
No, because you I
It's
won't.
ultimately, my opinion is not. It doesn't hold weight water against the 2 of yours because you guys saw all the information and you graded it. So it's definitely your decision. I just wanted to put my opinion into
Yeah,
the mix.
yeah. Should we split it? I know
Splitting
I
it
rate.
gives us I'm trying to look.
31.5.
Thank you. I mean, potentially, I think what I want to hold up is that there's no mention of any evidence-based programming or services more accountability to the models that this isn't the only residential like treatment program that I scored personally, and so I think I had the benefit of seeing the difference in cost.
See, and I don't know that, unfortunately.
I would lean more to my side than your side.
Okay. 20,
I think it's 28.
28? Okay.
So 28.
Yeah. 28.
Okay, the next Common Ground Friends application. We have a score of 23 from in the room, Scott, and a score of 38 from Allison.
Do you want me to read the description, Allison?
Yeah, this is 2.
Pardon?
Common Ground Friends 1.
2. 1, yeah, Common Ground Friends. The project description, Common Ground Group Friends proposes to establish the Bangor Counseling and Wellness Center, a flexible outpatient mental health and wellness program located in Bangor. The center will provide counseling, structured therapeutic groups, support hours, harm reduction, education, wellness service for the community, members affected by opioid use disorder, polysubstance use, trauma, and co-occurring mental health condition. That's what they want the money for. You want to go first? On how you scored it? Then I will.
Sure. It looks like I scored. I took away points for the data. Again, it was county level. And then some anecdotal information to support the need is what I have in my comments. I also took points for it not being clear what was specifically targeting OUD versus the other areas of need that they described. The majority of my points that I took had to do with the data, the rationale, and also the budget. It was clearly laid out, and it wasn't clear what was indirect versus indirect. Just because it was jumbled, so
I think that for what I deducted too, I just might have been a little bit harsher on it. Let's see. The people, I don't know if I should even say that, but I'm familiar with the people involved in this particular outfit, which was Mike Tuller in particular, and which you don't know him, but he read it out the application. Yes, it was on the application. Anyway, so that didn't weigh in how I graded the rubric anyway, but I definitely, because I think it's important. Okay. Project description doesn't clearly align with Exhibit E, just as you had said. The rational data, I gave it a 2, very basic understanding of the organization with limited description. Data tracking, I agreed with that too. I gave it a 2. And this is budget is unclear with very little or no detail, so we agreed upon that. I came up with a low score.
and this was largely setting up the drop-in,
Yeah.
not so much delivering services. That was being pursued through like regular insurance reimbursement stuff. Was that what you remember?
That's what I recall too. Yeah.
So this was
It's just a startup. It's startup.
Yeah.
Seed money.
the scope was a lot of identify a lease, sign a lease, get the furnishings.
So same ideas, probably just style and severity of
I think
grading.
the ideas were the same.
So do we think this is another one where the average makes sense?
It's fine. Me.
I'm trying to math, but I was supposed to be in bed.
Oh, it's 30 and a half.
32.5. No, so it's 15 points different.
Yeah, it's quite a difference.
I'm comfortable with just doing the average.
And then the last common ground one is a score of 29 and a score of 32 for an average of 30.5. This is Allison and Chief Hathaway. You feeling chatty?
This was a project that they're gonna purchase a home, renovate it,
15th.
their 15th.
For youth, young adult residential recovery,
Yes,
Okay.
the ask was specific to capital improvements to the property itself. So roof siding,
yes.
kitchen, maybe.
Yeah, those are interior renovations necessary.
The majority of the points that I took away had to do with it not being an acceptable use of the funds. There was a very thorough construction timeline, but construction is actually an eligible expense for the funding, so. A lot of those sorts of, the application itself was solid and it was describing things that weren't fundable.
Fair. I had concerns with the project description, the scope of work, data tracking, the budget, long-term sustainability. Excuse me.
Yeah, I did pretty big markdowns for project description. The data timeline, scope, and budget.
I found the population served to be reasonable.
Yep.
Felt the application adhered to the instructions, but otherwise I was average on most every other.
We're pretty close to average.
3 to go. Welcome to housing. This one has a pretty large discrepancy. A score of 41 and a score of 13 for an average of 27.
Question. Was this not graded 3 times? Because this was given to me accidentally instead of Wellspring. And then I sent in a grade for it anyway. But I'm assuming that means somebody else got it as well, or am I wrong on that?
Counselor Haas, did you grade this one? I could also have the name wrong.
Is this the one that they took furnishings and
Yes.
that kind of thing? I did, but I can't believe I gave it a 41. So, but I bet he didn't either. So.
I can tell you that I scored it a 48. So
Well,
I don't know really where that leaves us because I technically wasn't supposed to score it, I think, because it got given to me wrongly. I was supposed to receive Wellsprings and it was just a file mix up.
Gotcha. Well, if it wasn't supposed to go to you, we can disregard that score. But I mean, you're also going to be welcome to participate in the conversation and advocate for your score, so I'm not sure. Yeah.
honestly, when I did this, for the amount of money, and, you know, they seem to do it, turn things over quite frequently, was kind of, you know, they do provide things people need, but. So I'm fine, take that score up and stick it on there.
Shelley, just asked a question. The person sitting in the back is a member of the public. Not a participant.
I guess I'd be interested to hear, is it Allison was the other one who scored it? Why did you score it so low?
So Welcome to Housing is an organization in Penobscot County that provides free household items to people who are exiting homelessness. What they shared in the application is that they've seen an increase in their requests. Largely, they kind of anecdotally attributed that to the opioid crisis and the increased homelessness having to do with increased opioid use, causing people to lose their housing. And my score largely had to do, hold please. I didn't award full points pretty consistently. I think I didn't give any points for the budget. And the comments I have is that there's no evidence of delineating funds for the specific population or purpose. The indirect is 24% of their overall budget. What they submitted was a budget that showed their annual operating with the $5,000 award incorporated into that overall budget. So there was no clear idea of what that funding was actually used for. And then the description also wasn't very clear about what specifically they would be purchasing. They talked about their need exceeding what they have on hand for some items. But they weren't things that you could really put on a shopping list. They didn't really demonstrate any awareness of how they're directly serving people that would be the target population. There was no mention of how they would identify town of origin so that they could make sure it was people in Bangor. And generally no evidence that the funds would be earmarked for the specific population. So Bangor/OUD. No timeline. And then scope of work, there was a couple different places where they described using the funds in different ways based on the question they were answering specifically. And then no sustainability besides just describing that they always find other funds. No data tracking.
They do have a data tracking element, and I really only know that because I go there, but it does say that in here. In the how you collect your data track. We track recipients by basic information, agency, town, age, range, gender, whether they're veterans, the number of people in the household. And they also do it sheet by sheet. Anytime somebody comes in and gets stuff, they mark off everything that they get. And also it's a requirement when people go, a loose requirement that they have the case manager with them so that they're associated to some kind of other service as well.
Yeah,
That
and
is in there, just so.
when they spoke at the public comment question session, they indicated themselves that they weren't tracking and wouldn't be tracking the information that was required for it. And they cited HIPAA, which is not actually something that they would be held to. And so my notes for data tracking are that they describe the intended data tracking strategy that does not reflect ensuring funds are directed exclusively to intended recipients. Data limited to demographics versus metrics associated with the impact and the outcomes.
Yeah, that doesn't specifically mention the $5,000. That just kind of tracks what people are taking. So that's fair enough.
I think it missed the piece that would have connected everything the way it needed to be connected for the award.
So we have a 41-13. An average of 27. I think there's perhaps a question about whether if there's no connecting the recipients to the target population, whether it's a qualified use or whether we can assert that it's a qualified use.
Well, and I think that was where I kept getting stuck, is that the scoring, like my scope would be the scoring and then understanding that I'm also scoring things that
in their descriptions are making themselves ineligible to even receive the funding. And I think that piece is outside of this committee's final decision, because we didn't make the rules about money.
Can you elaborate on that? Just because I'm curious.
Yeah, I think for this one specifically, it was not demonstrating that they would be using the money just for the intended population. And then they also didn't demonstrate that the funds would go directly to the activities. It was just rolled into a much larger budget.
Yeah, okay, that makes sense.
So I'm fine with just the average. It's not.
Next on the list, Together Place, a score of 10 and a score of 32.
You guys all know that I've been a very vocal advocate for the Together Place. I didn't have anything to do with the scoring, and I'm not going to have anything to do with this conversation for that reason.
This was Chief Hathaway and Allison. Why can't I get my password correct? A few words about the project.
Well, I think that was a lot of my problem, is that it was very unclear to me what we were talking about. Did you have a clear sense?
No, looking at my scores, I was very average
Okay.
on every,
Yeah, it seemed to largely be describing an extension of the overnight warming center into a day center. And then the description, from my understanding of the services they provide, appeared to actually be describing the services they already do provide during the day. So I was confused about it.
it might have been an expansion of services currently provided. I think I wanted to, find a path for more support for this, but, I was average on it.
Yeah, I think where I struggled, because I also have an organization that I'm familiar with, and I struggled to make the connections that I was able to make when grading other applications. I really had to pull from my own understanding of them, not what was being provided. So based off what was provided, it didn't really seem to hit a lot of the marks.
That's fair. I would agree with that.
And then just because I keep bringing this up, it was a 58% indirect cost. And then, yeah, it was 19,000 for facility. Specifically utilities, cleaning and pest control, not typically something you would consider direct expense.
So a 10 of 32 average improvement. Sounds like this is a style difference. A pretty big
I
one.
think it is, because I think our thoughts are aligned on this. And two had budget issues.
Yeah.
Based on what you just said a moment ago, so I think the average is probably sensible.
Yeah, I mean, yeah, the average makes sense. I would also acknowledge, I mean, I would be okay going a little higher than the average. But I would defer to the larger group for that. Version.
Okay. Last one. Hope for Homeless. We have a 22 and a 2 for an average of 12.
Yeah. 1 second. Where is it? There it is. So this is like specifically one of the things that I was speaking to in previous sessions when I had said, but this is one of the things I had in mind. The people are going to request money that really do impact the community, that don't know how to ask for money. And that's what happened here. Um, while specifically this is given to primarily people who are homeless, it also really opens doors for case management, which then leads into all of that stuff. So I definitely think it's tied in, but the application was basically non-existent. It was like a blurb, which is really unfortunate. I
I actually
also
think
had a, sorry, go ahead.
like, no, finish your thought, sorry.
I also think that without providing any kind of track record of fiscal records, the $25,000 is a lot of money to ask for. I would like to see that they have been tracking or whatever they've been doing with their money and giving stuff out. Like, because it's just like a lot of money to just be like, well, we hope that works out. If that makes sense.
Yeah, it basically was the letter of intent.
Mm,
So there was nothing to score, which was the barrier that I encountered. I gave some points, a point, because they identified their volunteer network, and that's essentially their organizational structure. And that was the only thing that was really discussed at all that was on the list of things we wanted. In their scope of work, they did begin to describe what they do, so I did give them a point, and they identified additional food bags, but nothing linked directly to their priority population. What I said is their priority population is stated as individuals experiencing homelessness and doesn't address the geography or the population impacted by substance use disorder. So there's just
And
nothing to score.
for me, it's different because I know because I utilize the service and this is the food bags that go to the people who are experiencing extreme substance use disorder that are like not even going to food cupboards because they're like that despondent from society. And it's like super necessary, but like she said, none of it was there. I don't know how we reconcile that or even if that's possible. It's like if I could wave a wand, this is one of those things that would be funded, maybe not 25 grand, but significantly less if they can prove that they can track it. However, the application doesn't support that.
I think that was the hard part with me on this one, because I also understand and have seen the work that they do. And there's nothing to score.
mm.
So it's too bad.
So we have a 22, a 2. It sounds like the scorers are in agreement, sort of in substance. Do we think the average is the right score here?
I'm comfortable with the average. TV Scott,
Yeah.
are you comfortable with the?
Yeah, that's fine.
So I think next steps are, I'll take these consensus scores, put them into the spreadsheet, and then re-rank the totals. I'll create a new blue line that shows sort of who gets funded just based on scores and who doesn't. I will then have legal do a review of those applications to just flag any concerns as far as permissible uses. And then it sounds like we need one more meeting to officially vote on that list and finalize it. And at that point, I think that's the right time to have some of these discussions about whether there are specific applicants that don't go into the recommendation to council for whatever reason, or do, like the last one we discussed, because even though the application wasn't what we wanted, we think they might be worthy of funding.
So what about, like the first one, we had a reduction of funds. Is that the next meeting that we will do is a reduction of funds
I think we would want to vote on.
on the amount of funds? Now, what if there's funds left over that would bring up some of these people that are below the blue line? Because we have to spend it all, right?
I think there will be.
Yeah, I think
So
so.
it sounds like the blue
Yeah.
line will move.
The
The
blue
blue line will move.
Oh, yeah,
Yeah.
okay. Yeah.
presumably
Yeah.
some of these above are gonna go below and
Yeah.
vice versa.
Yes. Yeah.
Can we try to make this like soonish? Because I know people really want to get to this money. I don't know how soonish we could do it. And I know that everybody's busy, so I'm not trying to be unrealistic. You did say that legal's got to run through it though too, right? So we got to give it at least a little bit of time for them to do that. As I'm speaking, realizing that out loud.
Well, I know next week
Yeah,
was the regular meeting anyway on the 28th, right? Is that too soon for them?
I very much doubt that they will be able to review
Okay,
by then.
no problem.
The week after, so the first week in February.
How's it gonna be February? I'm mad about that.
Well, I'm sorry.
I can send around dates for that first week in February.
We have some
Yeah.
control. We do not have control of the days of the month.
Yeah, it doesn't make sense to really plan anything until we know the timeline for legal, right?
Yeah.
Right. I also think that's a really good plan. So thank you for doing that.
Yeah, so I'm going to Texas and I will be home on the 4th, but late at night. I'm leaving on the 30th and I'll be home on the 4th. So if there's something that you guys can do on dates while I'm gone, please do it because I want to move this along. But if I can be there, then fine, I will. But I am going to see Cooper Flag play the Celtics. So
Very
Worth it.
exciting.
Worth it.
yeah. So I will look forward to the dates and I'll see what I can work on.
Okay,
Thank you all.
are we adjourned?
I think we're adjourned.
Good night.
Wonderful.
Good to see you, Richard.
See you, Scott.